My name is Simran Siraj, and I'm very thrilled to welcome you to the second episode of our AI Insight series. Before we dive into today's discussion, I'd like to take a moment to highlight the vision behind this series and what AI-Sarosh really is. AI-Sarosh is a South Asian knowledge hub exploring the feasibility of artificial intelligence to solve sexual reproductive and maternal health problems in the region. The hub is funded by IDRC in Canada and Foreign Commonwealth Development Office FCDO in UK. We have so far supported 9 projects and 8 sub-grantees, who some of which are also in this call right now with us. This AI Insight series is an effort by AI-Sarosh to bring global experts and local innovators together to sort of discuss where we can build a future where AI, like we can talk about solutions. We also talk about solutions and innovations that are not just powerful, but also equitable and responsible and can be scaled to be accessible for most of who we are building solutions for. Today's session is a special collaboration with the African Center for Technology Studies AI Institute. We will dive into a topic that is timely and very critical. It's about equity in health, especially when we think about our solutions and innovation. When we talk about AI in healthcare specifically, I think the conversation often shifts to advanced tech, but the real challenge and also the real opportunity lies in equity, because how do we ensure that these innovations reach the most vulnerable, and how do we scale responsibly? And to help us answer these questions and guide our solutions and also build capacity within our sub-grantees, it will be my honor to introduce Dr. Ojenge Winston. Dr. Winston is the head of the African Center for Technology Studies, AI Institute, where he leads projects that bridge the gap between technology and human development. And he coordinates and mentors development teams across Africa to ensure that their solutions are impactful, scalable, and most importantly, responsible. With that, Dr. Winston, the floor is yours to take us through any insights that you have. Thank you.
Thank you very much, Simran. It's very nice to be here, and I will go very tentatively, slowly, because I really don't know how to present this, but I'm hoping that it will be a discussion. Number one, health is a very sensitive topic, and if AI is supposed to support our healthcare, knowing the risks that come with AI, then we certainly want to be extremely careful when we apply AI in health, so that those risks do not cause us pain, because really in health, we are talking about life and death. There's something that I need to mention here first, but even before I do that, I'm happy to be accompanied by my colleague, Pauline Soy, who is our communications officer at ACAII Institute within the African Center for Technology Studies. And Pauline is the one who set up the entire arrangement that we are having now from our end, and doing this together with Simran. Maybe Pauline, you may want to say hello.
Hello everyone. My name is Pauline. I'm not able to switch on my camera, but hopefully along the way I can switch it on. But happy to be here, and happy to meet Simran again. We were somewhere a few weeks ago together. Thank you.
Great. Thank you very much, Pauline. So there's also something else that I'd want to mention here, which I believe that my discussion is premised on. Most innovators, not just in AI, but basically in all technologies, have always felt that ethics of technology is out to muzzle and is out to silence innovation. And most AI innovators particularly see ethics of AI as regulation, that it's an attempt to regulate innovation. But we are working on a framework that we are hoping we should be able to share somewhere by mid of this year. And already initial studies is indicating to us that ethics actually enhances the scalability of AI. And one small example that I can tell you straight away is that in order for you to scale your technology well, for people to use it more, it needs to be inclusive. And inclusive here means that you need to actually capture in your innovation the problem that is being faced by the user community. And the only way to do that is that you co-develop, you co-define the problem with the user community. When you do that, you will capture the problem perfectly, because sometimes problems, you only see the symptoms, but problems are underneath. So you have to dig very deep in order to identify that exact problem. Sometimes the user community may also not be aware about the problem, the actual problem that they suffer from. And when you and them have a conversation, then it will be possible for you to be able, as an innovator, to be able to identify the actual problem, so that when you build your AI solution, you will actually be able to solve that problem. And that will enable you to scale, to deploy your AI successfully. And it's also one of the main principles of ethics of AI. So you can see that already in that example, ethics of AI and scaling of AI actually meet, and they reconcile perfectly. There are other areas where they meet that we are still going on with our research and should be able to highlight this. So today, my focus, therefore, even as I talk about equity in health and solutions and innovation, would be around the ethics of AI, or responsible AI as applied in health. Given that AI-Sarosh is a hub that likely has innovations that around health, it would be nice to hear whether there is any such innovations, and whether we could just hear a description of a particular or a favorite solution in health that AI-Sarosh has, and that they could describe, and then we can base our conversation around that.
Okay, hello everyone.
Yes,
I am
welcome.
Dr. Ihtisham from NEST, Pakistan. Our project AI GDMP, I mean the AI for the early prediction of gestational diabetes mellitus, is a project that is sponsored by AI-Sarosh. And we are doing this project with Shifa International Hospital, Pakistan. So I'm glad to be here.
Thank you, Dr. Ihtisham. Dr. Ihtisham, would you like to describe your solution? Like, what is it that you're working on? What is this innovation that your team has created so far?
Okay, so the solution we are developing is at the very core of it is a AI model which uses the early predictors risk factors as input, and we try to predict the gestational diabetes mellitus, which is usually diagnosed as a standard protocol using the OGTT test in the 24th to 28th week of gestation. So we try to predict it early in the first trimester, and specifically before 19 plus 6 gestational week. So that means we have some crucial window for intervention, so as to have a intervention by the doctors to see or to recommend lifestyle modifications to the mother. So at the core of it is the AI model. We have collected with Shifa International Hospital a data set of over 4,000 pregnant women. And we have utilized that as carefully applying all the steps of the AI or machine learning specifically to identify those low-cost factors, risk factors, or features, we say, which are not they are low cost. So I mean, this kind of a solution can be deployed in facilities which are low income facilities. So we have this model which is wrapped in a tool, in a software tool, and the software tool again can be utilized for a longitudinal monitoring, and it can also be extended to see other conditions like preeclampsia or other things like the NICU admissions or something like that. So this tool can be utilized in again in a setting. It can be tested, or it can be further investigated to be useful for other conditions. So we have the facilities of multi-visits. We have options of capturing multi-visits during the pregnancy episodes, like the trimesters and subsequent time of the after the pregnancy. So this is in brief what we are doing, and we were and we are very excited having this tool, and we are grateful to the AI-Sarosh for funding us. Yes.
But that is music to our ears. It's a powerful and exciting innovation, and I'm hoping that it is possible to deploy it and scale it so that mothers across Pakistan and then probably across the region may be able to use it, because in every home there is a mother, and such a tool therefore is used by almost the entire population. And I also know from experience that diabetes that comes with gestation is very common, and actually a lot of mothers and children lose lives. But I wanted to just ask one question, Islam. Is it already being used by a certain number of cases?
The study we have done in the first phase was a retrospective study.
Yes.
So we have to, given the identifying the files in the EMR,
Yes.
like we identified more than 30,000. Among 30 cases, we identified 8,000 pregnant pregnancy files, which actually meets the inclusion and exclusion criteria of the study protocol. So then among them, I mean, it's a retrospective study, so we have identified those files and we were actually then digitizing those files. And obviously, this is the, I mean, the test phase, and we are going to test it now in the second phase as a prospective validation of this tool. So we have not tested this in a real scenario or a real setting because it has to be approved by the hospital or ethical approvals for actually using it in the real settings and making interventions based on the tool. Yes.
Thank you very much. Then just one more is, but do you have any plans of who will use it? Is it the individual mother at home, or is it the doctors who will, the medical people who will use it? And if it's the individual mother or even the health facility staff, how will they access it, particularly if it is the mothers? Through what devices do you suppose they will be able to access it?
So the tool is actually developed for the doctors or the experts. So one of the main goal of the project was also to bridge the engineers and to bring together the engineers and the medical doctors together and win their trust. So the first thing is the tool is going to be used by the doctors in a setting where we design the study, like in a hospital setting. Later, when validated, it could also be used by, like, I mean, at the lower level or at the community level, where we have nurses or the midwives, maybe. So in the first, that is like this, and also and mobile application can also be integrated with the tool to actually give the patients their data, and they can carry their data. I mean, their profile or data that we collected. So, and also they can receive some life modifications. So that can also be included in the later stage.
Thank you very much. I really would love to hear, but certainly because we are within the same network, it will be possible to follow and see how this particular innovation will progress, but more importantly, to be able to see the impact that it has. So allow me then to just share a certain number of questions that we as innovators may want to be able to ask ourselves. But even before I do that, I also need to let it be known that most AIs that are developed may not particularly follow many of those questions. And some of those concerns or questions are too invasive, they are too demanding, that sometimes the resources are not even there for us to be able to observe them. However, it's just important for all of us to be aware that whenever we want to develop AI, there are those questions that we need to ask ourselves at every stage of the development. Then, like I said, if you do that, then you will realize over time, of course, we are still collecting data to be able to confirm that your AI will scale very well. Most users will find it very usable. Allow me, therefore, to just share my screen. So it's scaling of responsible AI solutions, and scaling and responsible, in my opinion, go together. And the framework that we are developing, like I said, we should be able to share it sometime mid of this year or towards the later part of the year. The laboratory where this research is happening is called Lab for Ethics, Policy and Scaling of AI, ACAII, and it's within the institute. This particular body of knowledge was developed by UNESCO. You know, sometime around 1948, just after the Second World War, the UN General Assembly, when it was formed during peacemaking process, one of the first things that it came up with was a body of human rights, body of knowledge of human rights, because the war had basically killed human rights. And they thought that if they mentioned this and highlight it, then it would probably be able to stop any future wars. But of course, as you know, humans are humans. Nothing scares them. So we've forever just been having wars. The UNESCO, what they did is they looked at the body of human rights because it captured the rights of every individual globally. And in their attempt, therefore, to try to establish the risks that are there in AI and how these risks can impact or breach human rights, they looked at the body. And they looked at AI and the features as they know it of AI, and then they distilled or isolated parts of the body of human rights that they thought that AI has a likelihood of breaching. And that came to be the 10 ethics of AI principles done by UNESCO. The beauty of these principles, there are many principles, there are many frameworks that have been made. Even OECD has made its own set of principles. Organizations, even universities, through their research units, have also developed ethics of AI principles. Even big tech like Google, etc., have also developed their own body of ethics of AI principles, just to convince users of their AI solutions or AI platforms that they're striving to be ethical. Why I like UNESCO, and any other researcher can also pick any framework that they like, is because the UNESCO ethics of AI principles is very encompassing. It basically addresses everything, even generative AI concerns within these 10 principles. And as you can see, the first principle is proportionality and do no harm. You need to ask yourself whether what you want to solve can only be solved by AI. We know AI has risks. So is it possible for you to solve these using any other method? So until you're able to answer that question, and say that, no, you can't solve it using any other method because it's purely data-based, then you can now go to AI. Then it addresses safety and security, fairness and discrimination, sustainability, right to privacy, right down to human oversight and determination, transparency and explainability, responsibility and accountability, awareness and literacy, and lastly, multi-stakeholder governance. These are very demanding principles, and some of them are actually not applicable in the development of certain AIs. And personally, I wouldn't worry so much as long as you look at those concerns and are able to address them or realize that they can't work, they're not practicable in your case. Now, these particular questions are what is of most importance to me. As you can see, they've been distilled from the UNESCO ethics of AI principles. But I would say that there were few, because every principle within that body of UNESCO ethics of AI principles every principle can have up to 10 different questions to address it. But you can see that these are few questions that we have isolated and feel that these are the ones that are most essential. And as you can see, the questions are according to the stages of the AI life cycle. And we are saying that the first, again, depending on the various frameworks, the titles or the names of the stages of the AI life cycle could slightly be different. But for us, this makes sense that the very first thing you want to do before you develop your solution is to do problem definition. Problem definition. Most times problems are not as easy as we think until we do go deep. And most of us researchers know that you will have to go deep, be able to describe the background well before finally you find. And some of those questions in the background or problems may already have been solved. Some people are making efforts to solve them, but you're looking for the cutting edge. At what point does the most advanced solution stop? So then you identify now what you can solve. So problem definition usually needs team composition. And the team usually should be, as you can see, number one, is the team comprising of a technical AI, of a responsible ethics of AI expert, of a scaling of AI expert. So the scaling of AI expert could be looked sometimes as the person who, the business expert, who will know how the AI is supposed to sell. But we know scaling is not just about profit. It could also mean social good. Because even if you were to give it to farmers, you would be happy if most farmers are able to use it, even if they don't pay money. But that is still success in scaling. So there are experts on scaling. Then there is the domain expert. Like in health, there are doctors, and it's a beautiful thing that this particular thing is being developed within a hospital environment. Because again, there are quite a number of AIs in health that are developed by the innovator alone without, interacting closely with the health people. Then there needs to be a statistician. When a statistician is important because when you want to identify the users you will be working with, you may not be able to touch base with all the users. For instance, within that hospital or within Pakistan, there are many patients that are mothers at gestation that attend hospital, but you can't touch base with all of them as you define the problem. There are too many, but you will need to pick a sample that you can then try to define the problem with. And this sample needs to be representative. And it's usually a statistician who will be able to lead you through the sampling techniques, because you may probably want a gestating mother who is at 17 or 18 years, very young. You'd probably also want another that is at 50 years, just towards the end of reproduction, because they will have different. You see, this condition will manifest on them differently depending on the age. You may also want those coming from very affluent backgrounds and those coming from very poor backgrounds. They'll also probably suffer differently because probably the diet, then also the geography. There are those coming from certain parts that will suffer differently from others. So you need to be able to sample correctly so that your users, or the ones you define the problem with, are quite representative of that population. And then you will also need a community expert who knows how to talk to the mothers. You, as the AI innovator, you may not have the right language to talk with these mothers. And as you know, some of these topics are very sensitive. So you will need that expert who already has a rapport with this type of people and be able to talk with them and get the data that you need. But like I say, this team is very costly to put together such a team. Sometimes they won't be there. So, and that is why we are saying that some of these things you can't observe them 100%. It's impossible. So you just do the best that you can. Then, and still under problem definition and team composition, then the question is, was the problem co-formulated with a representative sample of the user community? I'm totally convinced that this particular solution is using a very large variety of the user community, and that is likely to determine its quality and its ability to include everyone as in its operation or application. Third, was sampling done scientifically to include diverse geography and groupings? Yeah, so were persons with disability or women with disability also involved, etc. And then, is the team comprising? Okay, so now we are going to data collection, but even before data collection, now we've defined the problem at stage one. But the next thing is to determine the variables, those risk factors under which you will collect data. For instance, in this case, the risk is development of diabetes mellitus during gestation. So some of the things that you will probably collect data around may be the symptoms. So you will determine, therefore, what are the things that you will be looking for, that when you collect data around, they'll be able to tell you that this mother is likely, or expecting mother is likely to develop. So there will be symptoms. Maybe you will pick things like the weight, maybe the age, also, maybe the area from which they come from, maybe the levels of affluence, maybe whether it's the second child or the first child or the fifth child. So you will need to determine the variables, and you will first look at the problem and the objectives to solve that problem, and then you get the key performance indicators, and that is likely to be the same as the variables, or quite related to the variables. And as you do this, is your team well constituted? Then the next, is it possible to solve the problem now without AI? How essential is the AI here? So you must address that. And usually, if your solution is data-based, then likely that you will need AI. Now that you've developed the fields or variables under which you start collecting the data, to be able to solve this problem now, you go to data collection. So the question will be, does the AI solution collect and use private data? So you need to be able to say. And is the data then obtained legally from adequately informed persons? With the informed consent requested in the right language, and particularly for those women who will be illiterate, through voice, not through forms that they sign. So because you are going to use their data, and data, particularly health data, is very sensitive, you can't collect data from the medical personnel alone. You must ensure that the medical personnel have also explained this to these mothers, and in the right language and using voice, so that they're just not made to sign forms that they don't understand. Then is data anonymization done on the data? I believe that most of these things are likely to have been done by yourself. And is data being collected and stored under adequate data management protocol? Yes. Then now you go to training of the machine learning algorithms using this data, so that you produce the predictive models. So model development, therefore, would at this stage, you want to ask yourself, does the AI solution declare its accuracy levels to users without solicitation? So we expect, and this is very difficult, and I don't expect most AI models to do this, but as you can see, it's also quite important that we need to now start making efforts to see whether we can build a module which tells the user, that doctor or nurse at that primary healthcare facility who's using this, that after we predicted for that particular woman A that she is likely to develop diabetes maybe on the 3rd or 5th month, we need to find out whether she actually developed it as was predicted, so that the user is able to certify that because that's the only way you can refine your model. And then you can see the other question: does the AI solution explain why it has arrived at a particular decision? This is explainability. I find this usually very difficult, but now they are trying to develop models or modules that we can embed on top of our AI to be able to distill the logic, to consolidate the logic that the AI used to arrive at that decision. And then that would be the explanation. Because even doctors explain things to you. If they look at you, they measure you, your weight, your age, your symptoms, they will tell you that we feel that you run the risk of developing this condition on the 3rd month. Then you ask why, then the doctor usually will try to explain that because people with your specs coming from your region, with your age, the number of children, and with these symptoms usually develops this. You see, they must have some explanation. So the system should also be able to explain. Then the next one is the AI solution involved in deliberate presentation of inaccurate information? This is usually for generative AI. Is the AI solution involved in impersonation? Has the solution shown any signs of hallucination? So you will need to try to address this so that you build something that tries to avoid this. Does the AI solution have a self-audit module which queries the users about their satisfaction with the services and where the user could be, where they could be, the model could be adjusted? So it's very important that whoever uses this, at the end, once the prediction has been done, then the module will wait until after the 3rd month and send a small survey, maybe 1, 2, or 3 questions to the user that was it right? Was the prediction okay? So that it can allow your model to refine itself. Then has the AI solution or similar AI any history of causing injury? If it has, what measures have been placed to correct this? Is the AI solution sensitive to the local cultures? So that is also very important. So there are certain cultures that most AI may not contravene cultures, but some can. Some can contravene cultures. And then does the AI solution declare its energy consumption during training and querying? Now, this particular question, I don't expect most innovators to really concern themselves. But remember that AI consumes during it has heavy computation during training, and you need therefore to be sure that it will definitely have a huge carbon footprint if at all the source of energy was not sustainable, was not green. So you need to ask yourself these things. But even if the source of energy was green, you'd still want an AI model that consumes less energy than another. For instance, if you have 2 algorithms, maybe a neural network and a support vector machine, and support vector machine was guzzling so much power to give you the same model, to develop the same model with the same data than neural network, then you'll probably prefer neural network because the consumption is so high. Then the last set of questions is, during deployment, is the AI accessible on basic personal devices such as basic phones? So yes, I know that the women eventually are going to be able to try to access this service, and some of the health care workers at those rural clinics and dispensaries. But will they be able to afford smartphones? If it is based on a smartphone, would they be able to afford them? So sometimes then you may think of things like USSD services for basic phones so that they're still able to access. Yeah. And then do users incur significant cost in accessing the AI? So those are things that we must address. Otherwise, we will be excluding some people, some users. Is the media of the AI accessible to the various marginalized groups, such as persons with disability? Can someone who is visually impaired, who is blind, be able to use this service? Even then you need to ask yourself, probably then you would want to embed a voice module on it that can enable someone to speak. Of course, you may also have illiterate people who can't read and write and can only be able to communicate using voice. Then you could also have monolingual people. So which language was this developed in? And the users, can they access that language? So maybe you may think of a vernacular module. And then finally, what social impact does the AI have on the user community? There are frameworks that can enable an innovator to measure this impact. And how does it transform their lives? So that this is captured over the years. And then we may be able to answer the question whether our AI really was necessary in the lives of these people. So like I say, most of these things are very impractical in our contexts, and you may not really be able to want to bother with them. However, it's a good practice that during your development process, you are able to address these questions as you develop. And later, when the AI is now operational, it can still be interrogated around these questions to be able to tell whether it answers most of these questions well. Usually the difficulty in presenting this kind of work is that you cannot, as an ethics of AI expert or practitioner, come and start, preaching to the developers that did you do this? Did you do this? And a lot of times what developers go through is very rough, very extreme. And some of these questions are actually impractical and not applicable. And therefore, that's why it's just important that people work together as a multidisciplinary team. And the ethics of AI person will also be in the team, and we'll be able to see what is impossible to do and what is possible to do. And then that would probably be the best way. The last slide that I have here, but I won't go through it, is just a way to relate the JEDI and responsible AI and RAI. The JEDI is gender, equality, disability, and inclusivity. So you will probably be able to see that because these are processes that I know we will discuss within our network over the months, then you will see that the two are naming things slightly differently, but responsible AI is more encompassing because it takes care of things even beyond gender. But the concerns of JEDI is usually around exclusion of these groups. Yet responsible AI addresses all the 10 different principles. And I want to stop here and want to thank you very much, and then feel that if it were possible that we can have a discussion around this, I'd really be glad about it. But thank you so much, Imran, for doing this, setting this, and thank you so much, Islam, for sharing that exciting work you're doing.
Yeah, thank you very much, Dr. Winston, for such an insightful presentation. Okay, especially, I mean, these are some of the topics that I believe, because I am from the technical side of things, right? And I often had this discussion. Sometimes we do have this discussion with Dr. Imran, and okay, we're going to get you back into the humanities, right? Which is very fascinating thing. So from the technical perspective, for those like who are working the technical domains, these are really important points that are often ignored, right? So yeah, now the floor is open for a discussion. Any comments or feedback or questions, please? Okay, maybe I can jump in with a few of some of my observations or my maybe sort of questions, right? So equity related issues, right? Okay, and all these, which generally we call soft concerns. I don't know if this is the right word for it. Like this is also one of the maybe like a bit misleading that we call it soft and hard things, right? Okay. So in these projects, especially when we talk about healthcare, so the equity concerns, they are not addressed at the beginning. Okay. So, I mean, generally, like based on my experience, right? Maybe your experience is slightly different. So why there is this trend that when we go to the field testing or when we go to the evaluation phase, right? Then we talk about the equity, then we talk about the gender equity, diversity and inclusion issues. Why not from the absolute beginning? So why is this trend? And what can be done to, let's say, encourage people to follow a proper path for this?
Maybe
I
allow
think
me
I'd just
to.
like to add
Yes,
something to
Simran.
that question. I'm also curious that as someone who, mentors a lot of AI development teams, what is the most common challenge, do you think that teams often face when they're trying to move from a health solution that is in a pilot project stage to like a functional large system? Because I think things seem easier and these questions are often ignored when when like there's a smaller population involved. So what are some of the challenges?
Thank you. Let me just so thank you so much. Let me start with Imran. Yeah, it's I would not say that I'll have answers. You know, ethics of AI and responsible AI is also a very fairly young concept, and we're all struggling as we do research, as we try to look for information. But there's a trend that I have noticed. Why probably some of these concerns are not addressed early. A lot of times it's cost, because equity and many elements of the ethics and inclusivity are not very easy topics. And they are also they're not easy to understand. And a developer usually is most times, most developers are youthful, and there will be people who did computing, and they probably got into software development because they were very good at programming, etc. And now they are the ones developing AI. They need a whole ecosystem, a whole team around them. And sometimes it becomes very costly to be able to build this team. Of course, in the universities and across hubs, one of the easier ways to build such a team that is reusable is to identify a network of an ethics of AI, a domain expert, a statistician, all those things, and then they can be reused by teams that develop. Then it probably becomes cheaper. In a setting like a hub, maybe you have people like that so that they are able to assist every developer. In a university, you can have those people coming from the various departments, and then they're able to assist any AI developer who wants to do that. So partly it's the fact that the developers may not be aware, because majority of them are youthful. The secondly, it's costly to be able to put up such a team that would then advise and point out the right thing. I know that my answer may not be very adequate, but it's a lovely conversation that I would love to have with you, Imran, and everyone else, even within the network, as we keep on interacting. And then, Simran, yeah, the largest concern in this process of developing AI, there are many concerns, but for me, the largest concern is the two stages, and that is problem definition and then data collection. This is often done poorly. And like I say, most of the developers are youthful and they may not know that they can't just look at a situation and tell that this is the problem and then start, working out what sort of data that they need to produce. And again, data collection is very costly. So most people would go to existing data that was collected for a different task. And yet it may not be perfectly fitting this particular context. So data, once problem definition has been done poorly, and therefore data collection has also been done not very well because the right data was not identified, then we can't repair. The foundation of the house is wrong. So we can't repair. There's another a certain experience we had in at the coast, one of the counties of Kenyan counties at the coast. We were talking with farmers of maize, and they kept on telling us that we need a model that can predict rain for us. We can't predict rain up correctly. Our crop takes 6 months, 3 months. That's 90 days, and the rain also takes 90 days around there. But we need to predict the rain so that we plant at the right time. And then we struggled with this problem. And then later, because we had an agronomist with us, the agronomist said, but why are you planting this particular species of maize? There is another species of maize coming from Carlo. Carlo is the state-based researchers in livestock and farming and crop production. And they usually produce varieties of maize for every region. There is a variety that is fit for your area and it takes 75 days. So because it takes 75 days and the rains come 90 days, you have a whole 15 days to be able to plant not correctly, perfectly, and then you will still be able to catch enough rain. And that was solved so easily. So you can see that what was looking like the problem is really not the problem. And that's why problem definition is very important with the user community. You see it, and it's not an easy process. It's extended. So that you're there. Thank you.
Yeah, I think that was a very interesting example, right? One of the things that I also observed is that sometimes our focus is on the technology, right, rather than the problem itself. Okay, so I mean, like I sometimes give this example as well, that when we have a hammer, so everything looks like a nail, right? So rather than working on this, on the solving the problem, we focus on the technology, and then there are also instances where really we do not need machine learning solutions for it, or at least we do not need to invest on deep learning or large language models for it, right? And that can also create this sort of, I call it like the wasteful resources, right? That we waste those resources that could have been utilized in other domains.
That is perfectly true. That is perfectly true. We may just need, even if it's AI, it could just be a simple machine learning algorithm, maybe a decision tree. We're able to, and yet we still go and use a convolutional neural network, a CNN or a deep learning, and then we waste energy, we waste computing resources, and even time for training and querying. And then we really waste resources. Yes, that's for sure. That's for sure.
Thank you, Dr. Winston. Do we have any other questions? I think we have space for one last question.
I know, Winston, it is time, and I would like to, because it's a very powerful topic. And I did write to Iftar's comment that these variables or these topics were called soft. And I think we should challenge that. And the reason these have been considered something that is not tangible is probably because it is very difficult to measure, number one. And the focus in the past 200 years has been so much on technology that we are kind of we have been, and it's really important that right now, I mean, we are focusing, and I think something that the AI4D group globally and AI4GH, we are trying to emphasize this. We are trying to push people back to, okay, these are the important factors. Having said that, I think the idea of focusing on the problem has also a component that we as scientists, we love to innovate and we fall in love with our innovation. And it's just like a child, right? So when, for example, and sorry, Dr. Edsham, for picking you, but for example, if I have a GTM solution and I know it's important, I know it works. So I am so much in love with this idea that I have been working on for so long that it kinds of I don't want to use the word, but blinds me from the environment that problem is. And I'll come back to what you said. It's costly, and that is, I think, the major barrier for a scientist to look beyond just the problem. Like even within the problem, when we say identifying the problem, GTM, for example, is a huge problem. But GTM is not happening in a vacuum. It's not just, okay, this is GTM, and if I give them this solution, this will take care of everything. The most common variables when we talk about equity are geography, education, economic status. But then something that we tend to ignore is the interactive effect of all of these. In 2016, when I went back to Pakistan, I just picked up the national survey and I looked at mortality, infant mortality, because the project that we were working was on infant mortality. And when I tried to stratify the mortality based on education, the numbers for highest educated versus not educated at all, they were like far, far apart. And then there was the other variable was geography. For example, someone living in a rural area versus someone living in an urban area. The numbers for urban area women were as good as Europe. And then you add on another variable and you add on another variable. Sometimes when the people who work with numbers, we tend to forget the interactive effect of these. For example, a woman who has never been to a formal schooling, is in the lowest socioeconomic status, and is living in a rural area that does not even exist on the map. So after all this long background, my question is how we could reach those women who are not even in the data set.
It's a big question, and it's also very costly. I'm trying to get inside Islam's head. I know some of the challenges for him to say where that he's collected that amount of data from the first time that seed idea came into his mind. I know that the challenges have been serious, and particularly cost budget. And now I'm trying to imagine, and I would love to hear that maybe because time is almost gone, maybe at another forum, I would love to hear Islam tell me, how does he imagine reaching the borders, the very far-flung rural regions of Pakistan to be able to reach this kind of women, given that most of them probably would not just be talking vernacular and may not be able to read and write, and they still want to use this. And I know that it's not a very nice picture that it'd be able to paint. But however, there's something that must give us the drive so that we try as much as we can to look for the money, the funds, to identify these solutions. I'd love to do this particular study. I look at AI, whose innovator has said frankly that I did not consider certain measures. There are many measures I did not consider. I did not even, try to define the problem or pick data from a user community to co-develop with the user community. And now, what is the impact of your AI? Who is using your AI? How do the users find it useful? And then I get someone who was an AI that tried to observe all these things and then see what the impact of that AI is on the users. How do the users find your solution? And if we have enough cases to make this comparison, then we'll certainly be able to convince all innovators that, listen, we need to do these things, however difficult it is. Of course, resources will always be difficult.
Yeah, I think so. The other point that I think you raised is really critical, and we in AI for GH have been emphasizing about it, is the multidisciplinary approach. A lot of time, because the education system is designed in that way, that if I am a doctor, I will become a doctor, and I will not think about whatever I'm using has been developed by an engineer. So how does an engineer feel about it? When it comes to social sciences or the work that we are doing, it is like very multi-sectoral. It is very multidisciplinary. So if we are not engaging with the people who are more knowledgeable on other topics, then it's really hard to have a solution that can cater to the variables or the like equity, like responsible, etc., etc. So I totally, I think if I have to summarize, your whole talk is all about the cost. So how do we balance that the cost of collecting this information and developing a solution versus the cost of not collecting the information and not developing a solution for people? I think we can go on and on, Simran. It's already like 10 past the hour. I know everybody has important things to do. It has been a pleasure, Winston, to hear you one more time. I hope we'll have more of these. So I'll let Simran take the lead from here. Thank you very much. I appreciate that.
Thank you very much.
Thank you so much. Thank you, Dr. Winston, especially for that insightful presentation and for really opening the space to ask questions that make us reflect on how our solutions often exclude people who we're really designing it for, and how just designing for mothers is not okay. Going beyond mothers and classifying it into categories and really thinking about if it will reach them or not is important. To close us out, I know we don't have time for questions, but I just want one question. If there's just one thing that you want every developer, doctor, nurse, policymaker who will listen to this recording, if you want one thing from this call for them to take away, what would it be?
It's tough. There are many things, but I would love to develop a curriculum for all likely AI developers in the university on what Imran says rightly that we call soft, yet it's not supposed to be soft, so that the computer scientists who eventually are going to be the developers learn so much about how to talk with the user, because there's nothing technical, very little technicality about talking with the user. Is very social. Collecting data is very social. Once you've known what you need to, the technologies may be technical, but the interaction is very social. So that those who are building AI need to impart a lot of sociology inside themselves about how to study people in their environments and talk to them and listen to them in order to develop very powerful AI solutions. Thank you, sir.
Thank you. I think that's the perfect advice to give, because we don't just want, like, someone who's leading a project, a principal investigator, a research assistant to think about equity only, or even think about users for that point. So thank you for your time. On behalf of AI-Sarosh, I would like to thank you for sharing your expertise and to share your frameworks, to take our time to prepare for this. I would also like to thank Pauline for making this session possible. And for your commitment to responsible AI. We hope to do more sessions with your team in future. And I would also like to thank everyone who's joined here today. Thank you for being with us, and thank you for being part of this important conversation. If you enjoyed today's session, please stay tuned to our social media. We'll be announcing the next episode details in the AI Insight series soon.